The next group was working on building a competency-based accreditation system. Zohray?
Yeah. So the emphasis here was on building an accreditation system. So it was really talking about what are the key resources, what are the key processes that one needs to consider in building an accreditation system, and then as one is embarking on that journey, how can we nurture interprofessional education and then consider global versus local. So there were three components. The first one was really looking at the key steps and the key processes. And this really seemed to center, and we converged on the idea, really emphasizing stakeholders, that the process requires really an identification of who are the key stakeholders. And we looked at the WHO pentagram that Roger shared and Nelson referred to as well, that the key five stakeholders would be academics, policymakers, health managers, health professions, and communities. And really, it's not just about the stakeholders, but it's actually about the process. That the process really ideally would start with bringing these stakeholders together, including the community, to define the vision of what does it look like when these healthcare professionals are functioning optimally. And when you start with the vision and you back into the competencies, then you back into the accreditation system that actually supports that vision. So we felt that the process when you bring these stakeholders together was really important. We felt that there was a comment, and an important comment, about building trust, that as you bring stakeholders together, they might be ministries of health, education, finance, in some cases competing stakeholders, important to have upfront time and effort to build trust. And it might well be that the process of defining the vision is also helping to build trust. And that when you're building this accreditation system, it allows for feedback loops at multiple levels, with the practitioners who are already in the field to feedback, but also as the system itself is standing up, that there is opportunity to feedback and see, is the system working well? Is it keeping up with the values of the society? So this isn't a comprehensive list of what one would do to build a system, but some of the thoughts that we thought were critical. The second part of our conversation focused on how do we take the opportunity when we're building an accreditation system to really nurture interprofessional training and practice. And again, we said if you start with that process of building the vision and you back into the competencies, then you also back into interprofessional competencies and therefore the accreditation system that then reflects that. So we really again came to the issue of starting with the vision. And it was really nice to hear Nelson, who shared the process from Uganda, which is exactly what they've done in the recent past. They brought key stakeholders in the country together. They developed their accreditation system based on competencies that reflected the local needs and took into consideration the stakeholders. We thought, as we're thinking about interprofessional training, to agree in the country or in the system around nomenclature so that the different professions reflect on IPE similarly and incorporate it with the same ideas. We thought, again, as something that's come up this morning around the topic of meta competencies, are there certain leadership skills that might span across different professions? And could that be part of the different accreditation systems? We thought important to identify areas of common interest, but particularly areas of common challenge. So in limited resource settings, how can we work together to use limited resources? And that might be an area for interprofessional collaboration. And then not just limiting ourselves to recognizing that as you're setting up an accreditation system, there needs to be dialogue and platforms that also parallel that process. So that, just like in the other slide, we said you set up the system, but there needs to be a way to keep up with the evolving conversation in society, that as the value system in society or the health system evolves, that accreditation system can have a chance to reflect that over time. And then the obvious point that you can build an accreditation system for the education programs, but if the service environment doesn't reflect the interprofessional practice, then you're limited in your impact. So just to consider that. And the third slide, the third topic we considered was, how do you reconcile global standards versus local relevance? Tough question, but it obviously started with saying you need to look inward first. You need to consider the local culture, the local practice, scope of practice for the professions, and the service environment. That also any accreditation system obviously first needs to look at the local resources in the health service environment. So then we tussled with this idea that then how do you provide that sort of credibility, the global credibility that is desired out of an accreditation system? And one thought was, well, maybe, and we don't have an answer, but this was one of the ideas that came, is that maybe the global reflects the quality of the process. That the global standard is that your accreditation system should take into consideration the local health indices and the scope of practice, and the requirement is of the process, not necessarily of the competencies. So local should really reflect the competencies, and global reflects the process and the system. And that was one thought we had, and then we left on a question to say, but in fact, are there any global competencies that could span professions and geographies? No time to answer, so we'll leave that for some food for thought.
Great, thank you. Time for one or two questions or any points of clarification or additional comments. It must be late in the day. Okay, Malcolm, thank you. Here we go.
You speak of meta-competencies, and leadership is obviously the paradigmatic one of those. Are there others that you came up with that would be useful sort of nuclei around which to accrete the common things?
Malcolm is asking if we discussed any other meta competencies, but we didn't really dive deep. It started with the comment of saying maybe leadership skills is actually one of those skills that crosses disciplines, right. And that sort of backed into the idea of meta competencies. But we didn't dive deep. Does anyone in our group want to comment on other competencies that might have crossed? Because we were also talking cross geographies and disciplines, so it sets the bar quite high for meta.
Yeah, you might
Roger.
add cultural competency.
Yes, cultural. Yeah.
Cultural competencies.
We touched on communication actually as well. Yeah. Communication being a meta competency.
Okay.